So basically we're here too is, as you're saying, access is one thing, but it's getting that marijuana to the point where it can be accessed or even distributed.
Safely.
Safely is a major part of it that seems to be neglected in many of these
And it can
ideas.
involve money.
Right, exactly.
So New Mexico, they passed that law, and it allows for nonprofit organizations to distribute medicine, but it's still obviously going to be distributed for money. Nothing in this world is for free. So again, our bill that we proposed last year, working with the Legislative Reference Bureau, took that and expanded on it, saying, well, money won't be exchanged over the product. It will be exchanged over the land lease. And I mean, this is something that I've brought up in every testimony, is nowhere to date in the law does it say we can't do this. If anybody can show me in the law where it says that 5 patients can't grow together in a safe spot, I'd love to see it. I'd love to see anybody from the Department of Public Safety or any police department show me a law that says we can't do that. My issue was that I was growing for myself and one other person, and the police took all of my plants. So now what if I wanted to grow with 5 people? If they're going to take my plants and one other person's, what are they going to do when like 6 people are growing together in a safe, secure spot where somebody's always present and looking at it? So that's the thing, and nowhere does it say we can't do it. We're just looking to clear up the ambiguities of the law, the definitions that aren't there. They put words in the law that aren't defined, and so if we can just please define them and make it safer for us and safer for law enforcement, it would work. You know?
And that the patients get their medicine.
Yeah.
I think that's the main thing.
But they keep saying you can't do it, you can't do it, that's not legal. Well, where does it say we can't do it?
Right.
If
Right.
somebody-
And I think that's basically, again, they keep focusing on the enforcement aspects of it and the enforcement and what the police want to see happen. And it seems we keep forgetting about the patients and the doctors and their relationship, and what has been established is this is a viable medicine that they can use. And we forget that these are the one we even made this law for. It wasn't for law enforcement. It was for these patients. So I think that's what you're bringing up, is that this is got to be the primary focus of any of these real
On
reforms.
Friday, the Legislative Reference Bureau gave us our up-to-date draft of what we want this year, and it's basically takes everything from this Legislative Reference Bureau report and everything from last year and all the testimonies against it and try to put it in a sound way that makes it safe.
Right.
And so I hope you get a chance to read that. I hope you can pass that along to Representative
Yes, I will.
Mizuno.
I definitely
Thanks.
will. And this will be brought up as from this hearing. We'll then be distributing some proposed
We
legislation.
don't want a task force. Our bill was originally creating a system, and it was mutilated into a task force. We don't want to we don't want to start with a task force, because then it's going to be mutilated into nothing.
But I think what's safe is that you go with several bills.
Yeah, right.
Yeah, well,
Right.
that's what we did last year, and we'll do it again.
Well, I think
But-
also just the idea that, as we've talked also earlier, is that it could also be like a subcommittee of the health committee. There's other ways of convening people together to talk about things other than setting up an actual task force. So it could be that we actually then do this as a result out of this particular informational briefing. Then we can go to an actual like a subcommittee that we can actually start bringing folks together to discuss the proposed bill as well as any other bills
Right.
that we may want to
The,
propose.
the good thing is, if your bill passes, that's fine. But if
Something.
it doesn't, the task force is really to back it up.
Mm-hmm.
Because what happens is then the next year, the task force gives a recommendation 20 days before the convening of the, say for the bill passes in
10.
2009, 2010. With that recommendation, usually it's a lot, it gives us the momentum to move forward
Push
with this,
forward.
the bill in 2010 to pass it.
We want to cover all our bases. this
Any
time.
future briefings, we don't have a limitless budget, but we'll do our best to come and be present and participate, because
Thank
we
you.
want to
Thank you.
help.
Oh, and
And earlier you were bringing up, through my office, there's been a few hundred people who have filed complaints to HIPAA.
HIPAA.
I would
Oh.
do the HIPAA. And it's a website
Right.
you have to go to, and they've actually have been filing. One of the biggest problems we're having, though, is people like me, I never got my letter. Who got my letter? They never sent it back, that they never got it. And there's a bunch of letters that just went out that people didn't receive because of some
Right.
mix-up in communication there.
okay.
And
Okay.
there's one other thing I don't know if people have, I mean, it's something I've figured out here, that they wrote a letter to every patient being like, to me, I'm actually in our medical marijuana patient at this address. It was sent to my grow address. And I mean, isn't that a further, I mean, couldn't they have taken even the simplest
Registered
precaution?
mail.
Like, when I get tax forms,
State employees, I tell you.
they give me a certified mail when I pick up something with my social security number and any private information. This, they just put letters saying, medical marijuana patients, we made a mistake, we disclosed your information, so we're going to further disclose more information by just putting it in the mail without even the simplest privacy precaution.
And we hope you get it.
Okay, thank you very much.
Thank you.